Margaret, 72 years old, collapsed in her kitchen while making her morning coffee with absolutely no warning signs. One moment she was standing there like any other day, and the next she was on the floor, completely unresponsive. Her family believed it was a sudden heart attack, or maybe a stroke. That is what most of us would assume. After all, when something like this happens without warning, we immediately blame the heart. But what doctors discovered afterward told a very different story. Margaret's heart did not simply fail on its own. The real cause was something far more unexpected, something that had been part of her daily routine for years. It was the medications she had been taking. Every single day, she followed her prescriptions carefully. She did exactly what she was told. Like millions of older adults, she trusted that these medications were helping her stay healthy, protecting her heart, and extending her life. But in reality, some of those very pills were quietly placing stress on her body in ways no one had fully explained. And Margaret is not an isolated case. Today, millions of people over the age of 60 are taking multiple medications at the same time, often without realizing how those drugs can interact, overlap, and, in some cases, dangerously affect the heart. In this video, we are going to walk through 7 common types of medications that are widely used, often considered safe, but when taken long-term or in combination, may increase the risk of serious heart problems. More importantly, you will learn what to watch for and how to protect yourself or someone you love before it is too late. Because what happened to Margaret could happen far more easily than most people think. One of the most commonly used medications among older adults is acid reflux medication. These are the pills people take for heartburn, stomach discomfort, or what feels like too much acid after meals. They are everywhere, and many people take them daily for years without thinking twice. At first glance, they seem harmless. In fact, they often bring quick relief. But the problem begins when they are used long-term. Over time, these medications can reduce the body's ability to absorb essential minerals like magnesium and calcium. These minerals are not just important for bones, they play a critical role in how your heart functions. When magnesium levels drop too low, the electrical system of the heart can become unstable. This can lead to irregular heart rhythms, something that may not cause obvious symptoms at first, but can quietly increase the risk of serious complications. Many older adults continue taking these medications for years without ever checking their mineral levels. And that is where the hidden danger begins. Now let's move to another group of medications that are widely prescribed for high blood pressure calcium channel blockers. These drugs are designed to relax blood vessels and reduce the workload on the heart. In many cases, they are effective. But for some people, especially older adults, the effects can go a bit too far. Calcium channel blockers can slow down the heart rate and lower blood pressure to the point where the body struggles to adjust, especially when standing up. This is why some people feel dizzy or lightheaded when they get out of bed in the morning. That moment of dizziness may seem minor, but it can lead to falls, injuries, and in some cases signal that the heart is not pumping as efficiently as it should. Over time, this reduced efficiency can contribute to fatigue, weakness, and a gradual decline in overall heart function. And the most concerning part yet is that many people assume these symptoms are just part of aging, when in reality, they may be linked to the very medications they are taking every day. Another group of medications that many people trust without question are statins. These are commonly prescribed to lower cholesterol and reduce the risk of heart disease. For many patients, they are seen as a long-term solution for protecting the heart. But there is something most people are never told. Statins do not just affect cholesterol. They can also impact how your cells produce energy. This is especially important for muscle tissue, including the heart, which relies heavily on a constant supply of energy to function properly. Over time, some people begin to notice persistent fatigue, muscle weakness, or a general sense that their body is slowing down. These symptoms are often brushed off as normal aging, but in certain cases, they may be linked to how statins are affecting the body at a cellular level. When the heart muscle does not get the energy it needs, its ability to pump efficiently can gradually decline. This does not happen overnight. It happens slowly, quietly, and often without clear warning signs until the effects become more serious. Now let's talk about something even more familiar over-the-counter pain relievers. Non-steroidal anti-inflammatory drugs, often used for joint pain, headaches, or back pain, are some of the most commonly used medications in the world. Many people take them regularly without a prescription, assuming they are completely safe. But these medications can have a significant impact on both the kidneys and the cardiovascular system. They can cause the body to retain fluid, increase blood pressure, and reduce kidney function over time. When the kidneys are not working properly, the balance of fluids and electrolytes in the body begins to shift. This puts additional strain on the heart. More importantly, studies have shown that long-term or frequent use of these medications can increase the risk of heart attack, especially in older adults or those with existing risk factors. What makes this particularly dangerous is how normal it feels to take them. A pill for pain here and there does not seem like a big deal, but when it becomes a daily habit, the risk begins to build quietly in the background. Now, let's look at another type of medication that is often prescribed especially for people dealing with high blood pressure or fluid retention diuretics, also known as water pills. These medications help the body remove excess fluid by increasing urination. On the surface, that sounds beneficial, especially for people with swelling or heart-related conditions. But here is the hidden risk. As the body loses fluid, it also loses essential electrolytes like potassium and sodium. These minerals are critical for maintaining a stable heart rhythm. When electrolyte levels become unbalanced even slightly, it can disrupt the electrical signals that control the heartbeat. In more serious cases, this can lead to dangerous arrhythmias that may develop without obvious warning. Some people may experience symptoms like weakness, confusion, or an irregular heartbeat, but many do not notice anything until the imbalance becomes severe. This is why regular monitoring is so important, yet it is often overlooked, especially when someone has been taking the same medication for years. Now, let's move to a category that is even more common than many realize, especially among older adults: sleeping pills and sedatives. As people age, sleep problems become more frequent. Difficulty falling asleep, waking up in the middle of the night, or feeling restless are all very common. So it is no surprise that many turn to medication for help. These drugs are designed to calm the nervous system, slow brain activity, and make it easier to sleep. But that calming effect does not just stay in the brain. It can also slow down heart rate and breathing, especially when combined with other medications that have similar effects. For older adults, this combination can be particularly risky. The body processes medications more slowly with age, which means the effects can last longer and build up over time. This can lead to increased confusion, drowsiness during the day, and a higher risk of falling, especially at night when getting up from bed. More importantly, when these medications interact with others that affect the heart or blood pressure, the combined effect can place significant strain on the body. And just like the other medications we have discussed, the danger does not always come from one drug alone, but from how they work together inside the body. Now we come to one of the most critical and often overlooked types of medication: ACE inhibitors. These drugs are commonly prescribed to manage high blood pressure and protect the heart. For many people, they are an essential part of treatment. But like everything we have discussed so far, the risk is not always obvious. One of the key effects of ACE inhibitors is that they can increase potassium levels in the blood. Potassium is essential for heart function, but too much of it can be extremely dangerous. When potassium levels rise beyond a safe range, it can interfere with the electrical signals that control the heartbeat. In severe cases, this can lead to sudden cardiac arrest without warning. What makes this even more concerning is that high potassium often does not cause clear symptoms until it reaches a critical level. A person may feel slightly weak or tired, but nothing that immediately signals danger. Now think about this. If someone is taking an ACE inhibitor along with a diuretic or other medications that also affect electrolytes, the risk becomes even higher. This is where the real problem begins, because the issue is not just one medication, it is the combination. This brings us to a concept that more people need to understand: polypharmacy. Polypharmacy simply means taking multiple medications at the same time. It is extremely common among older adults. In fact, many people over the age of 60 take 5 or more medications every single day. Each one may be prescribed for a valid reason. Each one may be considered safe on its own. But when combined, they can create a complex interaction inside the body. You can think of it as a chemical cocktail. Some drugs amplify each other's effects. Others interfere with how the body processes certain substances. And some combinations can quietly push the body out of balance without any immediate warning signs. Over time, this hidden stress can build up and affect vital organs, especially the heart. And that is why cases like Margaret's happen. Not because of one single mistake, but because of multiple small factors coming together in a way that no one fully anticipated. So, what can we take away from all of this? The medications we talked about today are not inherently bad. In many cases, they are necessary and they do help people manage serious health conditions. The problem is not the medications themselves. The problem is how easily we start to rely on them without ever stepping back to look at the bigger picture. In my personal opinion, this is where many people run into trouble. We trust the system, we follow instructions, and we assume that if something was prescribed, it must be completely safe long term. But health is rarely that simple, especially as the body changes with age. What happened to Margaret is not about blaming any single drug or any one decision. It is a reminder that even well-intentioned treatments can become risky when they are not regularly reviewed or when too many are combined over time. And it is important to say this clearly. This story is not meant to scare you or to suggest that you should stop taking your medication. It is not medical advice, and every individual situation is different. If you are currently taking any of these medications, do not stop or change anything on your own. Instead, use this as a reason to ask better questions, talk to your doctor, ask for a full review of everything you are taking, check your blood work, understand how your medications may be interacting with each other, because in many cases a simple adjustment, a simple conversation can reduce risks that might otherwise go unnoticed. If this video made you think about your own health or someone you care about, consider sharing it with them. It might help them see something they have never questioned before. And if you want more content like this, focused on helping you stay informed and make smarter decisions about your health, make sure to follow the channel. Because sometimes protecting your health is not about doing more, it is about understanding better.